Hello everyone. Today we'll be studying about WHO new partogram which is called as WHO Labor Care Guide. Not so new though, launched in 2022 only. So this is very different from the older one. See the older one. That was WHO modified partogram. So new partogram is very different from the older partogram. Why we needed a new partogram? Because there were many discrepancies. It was said that here alert and action line are very linear line. They expect every woman to dilate at rate of 1 centimeter per hour irrespective of the parity of the mother. Whereas dilatation differs in respective to the parity. Also, as the dilatation increase, the rate of dilatation also increase. So it was said that the progress of labor is never linear like this. It is more of a sigmoid graph. That as the rate of dilatation increase, as the cervical dilatation increase, the rate also increase. So first thing was that. Then second thing which was said that many important parameters like maternal supportive care, whether mother is on fluids, what is the fetal position, they all were not included in this partogram. Third, they gave us the alert and action line for labor progress. That we have to be alert, we have to take action when there is problem in the progress of labor. But other parameters were ignored. There were no alert line, no action line for other parameters. That is why WHO Labor Care Guide came up. It was different from modified partogram. How it was different? First and foremost, whereas the modified partogram plotting used to start at 4 centimeter, the new labor care guide plotting has to start at 5 centimeter. First difference. Now there are no alert and action line. You can see in the new partogram there are no alert and action line. Second difference. Third difference was that new parameters which specially stress on a respectful maternity, like whether the mother has some companion or not, what is the maternal position, these all were added. Next difference was the value of the triggers was changed. The duration of labor difference was changed. So they changed the duration and the trigger when you have to take the action, that was also changed. Now the progress of labor does not have to be linear. The progress of labor change with the cervical dilatation. I'll show you once we'll start the plotting. So these were the major difference. Now let's see what are the various parameters. So WHO Labor Care Guide has 7 parameters. The first is the general information. It includes information about the mother, the parity, when the labor started and all those things. Second one is the important parameter and that is newly added, which is supportive care. We'll see what it includes. Second is about the information of the baby. Third includes the information about the mother. Next comes the labor progress, which includes the cervical dilatation, the descent and the uterine contractions. Then comes the medications. And the last is the plan. The plan is there is one column which is the alert column. So when your trigger, when your reading has crossed the alert column, you have to make a plan and write it down here. So WHO said you have to take 4 steps. First, assess. Always assess what is the finding. Then record it. So assess, record. Then check the reference value given by the alert column. For each parameter, alert column has given some reference value. So check the reference value and then make a plan, which will be entered in the last column. So on the x-axis, we have time. And on the y-axis, we have the alert column and various parameters. Let's see each one of them. So the first one, suppose the patient that comes to me is X. She is a primary patient. Labor onset was around 4 p.m. And active labor was at the 4 p.m. was the time when she told me pain started. And the active labor, which is the 5 centimeter dilation, started at around 8 p.m. And that's when I'll start the plotting on partogram. There were no risk factors and ruptured membranes was today's date, 10th of October. This is the first column. Second column, supportive care. Companion. First is companion. You always have to answer in terms Y and D. Companion is present? Yes. Not present? No. Denied? D. So see the alert. Can you see the alert column? If companion is not there, your reading is in alert column. You will make a circle and down you will write a plan. Plan will be provide her with companion. Right? Yes and D, that is denied, are not in the alert column. No companion is in the alert column. Similarly, pain relief. Is she having some pain relief? Yes. Not having pain relief? No. Denied. Again, N, yani no pain relief, is in the alert column. So if I write down here that there is no pain relief, I will circle it. Then I'll make the plan. That explain her the value of pain relief. Start pain relief using either epidural or opioids like fentanyl, pethidine. They all will be used. That will be my plan. Oral fluids. Again, yes. Oral fluids, no and denied. If it is no, I will mark no. I will circle. I'll make a plan. Start oral fluids. Encourage oral fluids. In the posture, posture can be supine shown by SP or it can be mobile. Supine, all the time mother is supine, she is not active, is an alert value. So if I write down supine here, I will circle it and I have to make a plan because it has crossed, it has reached the alert value. My plan will be encourage movement. So no matter how small the plan is, I have to make a plan when my value reaches the alert, the reference trigger. So this was first column, supportive care, where we have companion, pain relief, fluid, oral fluid, and the position of the mother, the mobility, posture. In the second column, just like that, we have the parameters for baby and we have certain parameters which will need us, which will show us that you have to be alert. Like basal fetal heart. Basal fetal heart less than 110. I have to get alert. I have to make a plan. Basal fetal heart more than 160. I have to make a plan. So plan will be if the heart rate, see this one column is of 1 hour. So fetal heart rate has to be taken every 30 minutes. Can you see they have divided? So in first stage, fetal heart rate has to be taken every 30 minutes. In second stage, fetal heart rate has to be taken every 5 minutes. So if I somewhere write down fetal heart 100, I have to circle it because it has again crossed the threshold. And now I'll write down the plan. My plan will be that change her position to left lateral, give her oxygen, give her some fluid and inform the senior personnel. Those will be my plan. And I'll take the fetal heart again. So management will be accordingly. So second column has baby fetal heart, fetal decelerations. So decelerations will be mentioned as no deceleration, early deceleration, late, variable. And I'll get alert when the decelerations are L, that is late. If I write down deceleration N, I will not circle it. I write down deceleration E, I will not circle it. I don't need to make a plan. I'll continue fetal heart monitoring. Right? Amniotic fluid. Amniotic fluid can be slightly meconium stained, M+. It can be moderately meconium stained. It can be thick meconium stained. It can be blood stained. It can be clear. When will I get alert? Come, see what is the column says. When it is thick meconium stained and blood stained, I'll circle my finding. I'll make a plan. That is the time I'll get alert. So this new this new partogram has given an alert reference value to each parameter. Fetal position. Fetal position can be anterior, it can be posterior, occipito, it can be occipito transverse. I'll get alert when they are occipito posterior and transverse. Same caput and molding. I'll get alert if the caput is 3+ or molding is 3+. Otherwise, I don't have to. So these are baby parameters. Maternal parameters. It includes pulse. So I will write down pulse 110 normal. Then I'll write down mother BP, which is suppose 130/80 normal. Then I'll write down, okay, systolic here, diastolic here, right? I'll write down the temperature, and then I write down the urine protein and acetone both. And everything has been given an alert value. Pulse rate less than 60, more than 120. You have to intervene. Otherwise, you don't have to. Right? So this is how you will mark everything. You will, again, what are the 4 ways of marking it? Assess, then record, check with the reference value, and then make a plan. In these 4 steps, you put down everything on the partogram. Next column is the most important one, is the labor progress. In labor progress, first is contraction. So when the contractions are, if you can see here, just give me a second. If you can see, if the contractions are less than 2, I have to get alert, start oxytocin. Contractions more than 5, it is tachysystole. Again, I have to get alert. If contractions are more than 5, again I have to get alert. Same duration of contractions, less than 20, more than 60. One thing has been removed here which was there in older partogram, and that is the strength of contractions. The strength of contractions which we used to label by putting the dot or the line on that square, that strength of contraction has been removed. Next, see this, the cervical dilatation. Now there is no alert and action line. They say that as the dilatation increases, this is centimeter, 5, 6, 7, 8, the duration gets shortened. So if she is in 5 centimeter, I'll do PV after 4 hours. Again, she is 5 centimeter, I am okay. But see, the alert is 6 centimeter is the alert time. For 6 hours, if the dilatation is 5, I need to make an action plan. And as the cervical dilatation increase, this duration decrease. If she is 9 centimeter and after 2 hours she is still 9, I need to get alert. So the duration of that dilatation will change with the dilatation ka centimeter. As the cervix is getting dilated, the duration of the labor progress will decrease. So if she is 6 centimeter and even after 5 hours she is 6 centimeter, I'll circle it, I'll make an action plan. I'll see the contractions, I'll see whether she needs cesarean, I'll assess cephalopelvic disproportion. So those action plans will be done. So this is the major change from the WHO modified partogram. If you see descent, again descent is plotted as number of fetal parts felt per abdomen. It can be 0, 1, 2, 3, 4, 5. But descent has not given any alert reference value. It means agar descent slow hai to bhi you don't have to worry. You have to worry when the cervical dilatation is slow. Theek? So here we have discussed. So here we have discussed 5 parameters. We discussed the general parameter, then the supportive care. How do we write down Y and D? Yes, no, denied. And we have to every time check with the alert column, make a circle, make a plan. Then the baby features, which includes fetal heart rate, fetal heart deceleration, amniotic fluid, caput and molding. Then maternal features, which include pulse, blood pressure, urine proteins and temperature. In the last labor procedure, in the labor progress. Next comes the 6th column, which is medication, which includes oxytocin, any other medicine and IV fluid, which you have to give. There is no alert column in here. And then the assessment and plan. Here you have to write down plan for each of the alert value. So these 7 parameters are there in the WHO labor care guide. You have to start the plotting at 5 centimeter. There are no alert and action line. Labor progress is not linear. In fact, it is more of sigmoid. And for every action, you have to assess, record, check with the reference and make a plan. I hope this partogram is clear to you. If you have any doubts, write down in the comments.